Diabetes, the silent killer. Diabetes today is a very common disorder affecting at least one person in every two families. Usually, symptoms and effects of diabetes appear very late, sometimes even after 10 years. Hence, most of us are not even aware of this silent killer, making the situation even worse. So much so that we have the dubious distinction of becoming the diabetes capital of the world. Estimates say that India would have at least 80 million diabetics by 2030. So, what is diabetes? Diabetes is a disorder in which our body is either not able to use insulin or does not produce enough of it. Sometimes our body does not produce insulin at all. There are two types of diabetes. Type 1 diabetes, that is, juvenile diabetes, usually affects those below 30 years. Here, the body does not produce insulin at all, and the patient has to take insulin from outside. Tablets do not work here. Type 2 diabetes, that is, maturity onset diabetes, usually affects persons above 30 years, wherein their body either cannot use insulin or does not produce enough insulin. Symptoms of a diabetic patient. A diabetic can be identified by several symptoms. Feeling thirsty always, commonly known as polydipsia, wherein the person feels thirsty in spite of drinking water. Frequent urination, commonly known as polyuria, wherein the person urinates frequently, especially at nights. Unusual hunger, commonly known as polyphagia, wherein the person feels hungry quite often and eats repeatedly. Unusual tiredness, wherein the person feels tired very soon and feels like taking rest often. Loss of weight, wherein the person loses weight in spite of having a proper diet. Diagnostic tests for diabetes. Blood is usually taken to check the glucose level by conducting two tests. Fasting. 8 to 10 hours of fasting. Usually it is taken early in the morning or an empty stomach. PPBS, postprandial blood sugar, 2 hours after taking food. Targeted range of fasting for a non-diabetic, less than 110 milligrams per dl. For a diabetic patient, ranges between 90 to 130 milligrams per dl. Targeted range of PPBS are: for a non-diabetic, less than 140 milligrams per dl. For a diabetic patient, less than 180 milligrams per dl. Targeted range of HbA1c for a non-diabetic, less than 6.5% for a diabetic patient, less than 7.0%. Besides, there are also other diagnostic tests like OGTT, oral glucose tolerance test. Urine sugar is also done to determine the extent of diabetes in the patient. Long-term diabetic complications affects vision, commonly known as retinopathy, wherein the person experiences blurred vision. In many cases, the patient may also lose sight completely. Affects kidney function, commonly known as nephropathy, wherein the kidneys do not function properly. In many cases, the patient may even have to undergo dialysis. Affects nerves, commonly known as neuropathy, wherein the person loses nerve sensation. The patient does not realize about injuries at all. This leads to major complications and many times even amputation. Managing your diabetes. Remember, diabetes cannot be cured. It can only be managed. This can be done either by modifying your lifestyle, medicines, or a combination of both. Lifestyle modifications for managing diabetes. Exercise and diet play a very important role in managing diabetes. Exercise. An early morning walk can do wonders. Light exercises can add to the benefits. Diet should include fruits, leafy vegetables, soluble fiber food, and starch-rich food. Avoid gaining weight. Extra body fat in type 2 diabetics makes it difficult for them to produce and use their own insulin. Avoid smoking. Smoking usually worsens associated complications of diabetes like hypertension and heart diseases. Avoid fats and sweets. Fats and sweets should be taken sparingly. This is for your own good health. Medicines for managing diabetes. For type 2 diabetes, medication would include either oral tablets, insulin, or a combination of both tablets and insulin. This varies from patient to patient. For type 1 diabetes, insulin is the only therapy. What are insulins? Insulin is a hormone produced in the pancreas. It helps in carrying blood sugar to cells to produce energy. Insulin works like a key to open the doors of the cells. If there is no insulin, sugar remains in the blood. A silent killer. How to use insulin? Gather all the required things: syringe, vial, cotton swabs if used. After removing the vial from the refrigerator, keep it out for 10 to 15 minutes so that it should attain room temperature. Take the vial in your palms. Roll it 10 to 15 times or shake it slowly without giving jerks 10 to 15 times. Fill the syringe with air equal to the number of units of insulin to be injected. Now, insert the needle inside the vial from the top of rubber stopper. Fill the air inside the vial by pushing the plunger of the syringe from behind. Next, take the vial with the syringe, keeping needle inside. Keep the vial upside down. Fill the insulin slowly by pulling the plunger out from the syringe. Choose the area of a body where you want to take the insulin. Abdomen is the preferred site for taking it, since absorption of insulin is better and it is also easy for the patient to inject himself or herself. Make a big fold of skin with your forefinger and thumb. Hold the insulin syringe like a pen while writing. Hold the syringe with needle pointing towards the skin fold at 90 degrees. Keep the needle near the skin fold from the top and inject the needle with tap method. Continue doing so until you push all the insulin. After you have pushed all the insulin, wait for at least 10 seconds, or you can count up to 10 slowly. After this, take the needle out. Don't rub or press the injected area. Insulin fills colors in your life. It allows you to enjoy life like a normal person. Insulin is our friend and gives us smiles and a healthy life. Foot care. If you are a known diabetic, take care of your feet. Here are some do's and don'ts which you as a diabetic should take care of. Do's. Check your feet daily for any injuries before going to bed. Use a mirror to see below the feet for any injuries. In case of any injuries, wash your foot with soap. Apply some antiseptic lotion and consult your doctor. Apply moisturizing lotion to keep the feet soft. Always cut the nails straight across to avoid any injuries in the corners. Always wear soft and well-fitting footwear. Use athlete shoes which are best for morning walk. Footwear for diabetic patients is available at shops now. Don'ts. Never walk bare feet, not even indoors. Don't put your feet in hot water. Don't soak your feet in water for long. Do not apply any lotion between the toes, which may cause infections. Remember, diabetes cannot be cured. It can only be managed. This can be done either by modifying your lifestyle, medicines, or a combination of both. Insulin fills colors in your life. It allows you to enjoy life like a normal person. Insulin is our friend and gives us smiles and a healthy life.